name's Michael Wells. I'm the EMS Data Analyst at Montgomery County Hospital District. It's kind of a simple term for many hats. So my primary role is working with our clinical and operational teams to use our various data sets from CAD to ImageTrend Elite to even our Billing Bridge site to generate operational insights and then also clinical quality improvement. The hospital outcome data is crucial for our continuous quality improvement process and ensuring that our field providers really are working at the top of their clinical game. We've really focused on forming relationships with our hospital partners, because once you have the buy-in from the hospital and buy-in from your EMS leadership, then it just comes down to working out the technology, which is the easy part. So those relationships have been key for us, and then using that data, we do a lot of things all the way from trying to work with provider mental health and reducing traumatic stress and chronic stress in our providers by providing loop closure, providing the kind of the gold standard of what actually was wrong with the patient for their clinical education. And then one of my passions is clinical research, and right now we're working on a research project where we have taken our telephone stroke diagnostic tool that's used by our dispatch center and evaluating its accuracy against paramedics doing a stroke activation in the field, and then also using the hospital outcome data to determine whether or not the patient actually had a stroke. We wouldn't be able to do what we do without Data Mart. Having the very granular access to every single data point in our system and having it in a format that we can access in near real time and combine with other systems and use various analytic tools to analyze that data really has made it possible for us to do what we do today. While the built-in reporting features are fantastic and wonderful, the Data Mart just gives us an entirely new level of flexibility to do anything we need to do with the data that we collect through Elite. There are really two core values that me and my team apply to how we manage our software systems. The first being that human beings are innately designed evolutionarily to conserve energy and find the shortcuts. So if you make the shortcut or the path of least resistance the correct way to do something, human nature works for you instead of against you. Another core value of ours that we try to focus on is cognitive offloading. Let human beings, or save human beings mental effort for things that the technology can't solve for us. So whether that is calculating medication dosages or using validation rules so crews don't have to remember that, when I transport to this hospital, this has to be filled out differently. We can use the technology to guide them through that. So it's just one less thing for them to focus on. We have a very high expectation, both clinically and operationally, from our crews, and it's just not reasonable to ask a human being to put that much effort and never be wrong about the little details. So if we can solve some of those smaller details for them with the technology, then they're able to apply that energy to providing better clinical care for our patients and serving our community. It's hard to narrow it down to one particular rule. We really have kind of a continuous improvement idea when it comes to our validation rules. Any issue that comes up, whether it's a clinical review or operational review, if it's something that we can solve with a validation rule, we'll make that change. We're making changes almost every week to continue to hone those validation rules. If I had to narrow it down to just one that has really helped us, and this kind of ties back to getting that hospital outcome data, is we've built 4 or 5 validation rules about getting the hospital encounter number. We've built 4 or 5 rules about that hospital encounter number, and we were able to get the correct format of the number for each one of our hospitals, make sure that when they go to this hospital, it's the correct length, it starts with the correct prefix so that they're getting the right number off the label. We played a little bit of whack-a-mole to get all of the times that they filled out 99999 or 11111 in that field. But also, we know that there are legitimately sometimes incidents and when they can't actually get that number, whether registration at the hospital is backed up. So we have a supplemental question that they have to explain why. So the path of least resistance is to just do it correctly, but we still account for all those times when it's just physically impossible to. Old saying of garbage in, garbage out really does apply. The data quality that we have because of the flexible validation rules and the ability to always change towards making it better when we find a new circumstance that didn't quite fit the rule before means that we're always improving our data quality, which means that our reports are clinical review process is always getting better just because the data quality is improving. We reduce the number of false positive alerts that we send to our admin staff when we improve that data quality. We improve the accuracy of the research that we do when we improve that data quality. So everything that we do to improve the data quality directly benefits the patients in our community. There are two big things I'd say that we got from feedback. The first is when we first implemented, for about the first couple months, the biggest complaint was, well, I was done so quickly, it doesn't feel like I actually finished my report. It feels like I'm missing something. So during initial implementation, the feedback was, oh my gosh, this is saving me 10, 15 minutes a chart, and it's a lot more streamlined and easier for them to use. As time has gone on, we have the biggest outcome of this has been that we're building relationships with our field providers where they feel empowered to come and bring suggestions back to us or bring issues that they've identified back to us so that we can continue making it better. The number of times that somebody has said, hey, I know it's a small thing, but it's been driving me crazy for 6 months, and they actually tell me about it, and it turns out that it was about 3 clicks and 5 minutes on my end to fix it for them. When they see that it's so easy for us to improve that, they start bringing back more and more. So we've really built the relationship with our field providers and create a culture where we can make the PCR something that not only do they feel like they have buy-in in, but the entire organization is working to improve, which then improves that data quality and then improves the clinical care that we're able to provide to our patients. The first would be if you don't have a clinical background, if you're more of a kind of an IT background, then you have to get out in the field. Go do some ride-alongs with your people. If you can sit next to them and see the pain points in real time of them completing that documentation, especially when you have knowledge of all the customization that's available in ImageTrend, you can go, oh, well, that's easy to fix. We can make this better. But unless you have that experience of sitting there right next to them to see that, it's hard to apply the tech to something that you're not familiar with. On the if you do have clinical experience, like most of our team, you have to remember that once you move into the office, you start getting distance from that. So build the relationships with your crew members. And always be open to the feedback. Another one of the core values that we follow is there is something that we can learn from everyone. No matter our opinions or personal differences, there is something that person can provide to contribute to making our product and our processes better. I think one of the key takeaways, and this is true across both of my sessions, is no matter how frustrating it may seem working with your field crews to get the documentation done, or how much it may seem that they try to fight the rules and everything, if you really take a step back and put yourself in their shoes, they're just trying to get through their shift. They've had a stressful day. So one, give them the grace and patience to do what they do best, the clinical care, and then always have an open mind to see how you can support them better and how you can make their day easier so that we are keeping our patients the center of everything that we do.